I am Dr. P.C. Raka, worked in various capacities in the government of Rajasthan at secondary level institutions, as well as in directorate under World Bank project also, as well as in development of free medicine and free diagnostic services in the state. Today I am going to deliver on the basic quality principles in healthcare delivery because most of the time the quality becomes the main issue when healthcare delivery is considered and when healthcare delivery is monitored and evaluated. First and foremost thing in healthcare delivery is the healthcare system. And I want to project before you that what should be the mission of the government, what should be the vision of the government, what should be the vision of private institutions and other healthcare delivery institutions. India is to be a country of healthy individuals, families, and communities through a health system that is equitable, means everybody can have access to your health system. It should be affordable so that it reduces the out-of-pocket expenditure when it comes to healthcare delivery. It should be efficient so that it can be comparable with the private sector or with other institutions, and of course the technologically appropriate, environmentally adaptable, and first and foremost thing is it should be patient friendly with emphasis on quality, innovation, health promotion, and respect for human dignity, and which promotes individual responsibility and community participation towards an enhanced quality of life. So the viewer of this video has got two components. On one side, the healthcare delivery institutions, policy makers, government, and on other side, the community and patients. What I used to discuss in most of the lectures for healthcare managers as well as in other institutions, the laid down principles I used to discuss, and first and foremost is to ensure that patient drive the quality. Always we should think in this term, if the number of patients are there at your institution, they derive more quality if you feel that quality is one of your key responsibilities in the institution. Patient always come first, and it should be considered always first. Decision should be based on patient requirements and expectation. If you are five-star hospital and you are not meeting with the expectations of the patients, you are not meeting with the expectation and requirements of the patient, then I don't think so that you are delivering the quality healthcare services. Patient feedback must be solicited. It should never be ignored. Always feedback is the thing which help us in improving the quality at our institution. Welcome their complaints and requests. Don't ignore them. Learn how your patient use your services, whether they are coming with pre-appointment, whether they are using the registration services comfortably, and ask patient when he leaves your hospital, be free from the consultation, or when he being discharged from the hospital, that are you satisfied? And how can I better serve you? These are two key important things. Are you satisfied? And how can I better serve you? This is the first and foremost principle of the quality. The next is treat everything as a process or part of one. Not only a single person can address the issue of quality in the hospital, neither management nor consultant. So it's a process is a sequence of activities that produces desired output and result. From registration, from trace area, to your laboratory, to your radiology department, to your consultant chamber, to your indoor, everything counts. Reliable processes yield consistent results. Best known process should be adopted as a standard procedure. Best known process. It may be in any of the hospitals of the town. If they are adopting it, that is a good process. There should be no shame in addressing and no inhibition in addressing the same principle in other hospital also. Cross-functional technique focuses the entire organization and definitely on customer satisfaction also. Most of the time I used to say that improvement is not a one-day activity. It's a continuous. Change is a fact of life and patients' expectations are no exception. So continuously improve your services. What is best today may not be best tomorrow. Technology changes. Everything changes with the time. The equipment changes. So if you are addressing the quality of services, you should have a continuously changing system in your institution. There is no alternative. Even the best in their field must continue to improve to stay number one. If your goal is to improve to the extent that you are number one, then definitely you will be nearby to your goal. Lasting improvement is achieved through a series of small steps. Not only a single step will take you to the top of the quality principle. No, there should be small piecemeal changes, small piecemeal improvement will definitely improve the quality. Infinite improvement of processes should be the ultimate goal of healthcare delivery system or health system. Then build quality from the start. Don't forget that you should have the policy of quality first in your hospital. That is placing such concern as cost, acquisitions, capital, employees, human resource, short-term profits should always be considered as second. Then only you will be able to address the quality. Quality first obligates everyone involved in the process of provide error-free work. I used to say in most of my lectures that if right person is doing right work at right time in a cost of effective manner, then that is the best quality for that particular patient. And definitely it gives long-term profits. Solve problems using data and facts. I don't deny that at this stage we are not following this principle. But if there are any gap in following this process, we should address, and I should brief this principle like before solving problems, first get the facts and collect the data. Who is responsible for it? Whether it is a non-technical staff, technical staff, paramedical staff, consultant, or the management of the hospital. There are several tools which you can follow. That is check sheets, which are almost prepared in every hospital, Pareto charts, cause and effect diagrams. Definitely they help in addressing the problem. Collect, display, analyze, and share the data. We should be very transparent in the institution that all the data collected, they are well displayed, they are well shared, they are well interacted, they are well discussed in the hospital quality meetings, quality committees. Pinpoint the root cause of the problem. If you could pinpoint the root cause of the problem, that problem will never occur in your institution second time. The goals of the quality, cost delivery, safety, and moral health ensure that decision will definitely in the favor of customer and customer satisfaction. I always used to say that we should involve everyone in the institution when it comes to the policy making, when it comes to the quality services, when it comes to the customer satisfaction, and employees are to be considered as assets, to be continuously developed, valued, and treated with dignity. Ongoing trainings, education, and skill development programs should be continued in the public sector as well as in the private sector. And this thing we try to do under the World Bank project. So, to sum up, I want to share my experience, what we did in 7 years under World Bank aided project. Practice with kindness, ethics, and honesty. Definitely, it is going to address your quality, and this can be done by some of the programs of behavior change and communication in the institution. Upgrade professional knowledge and clinical skills can be done by CMEs, clinical meetings, skill development programs, some of the trainings which are need-based trainings for the consultant. Maintain good patient record. It helps and it addresses the issue of quality. Maintain good communication with patient and relatives, because you have to face many times that there are few VIP patients, and under this VIP patient and VIP syndrome you have to take extra precautions. So good communication with the primary physician of the patient, good consultation with the patient, good communication with the attendant of the patient, it addresses the issue of quality. Maintain doctor-patient confidentiality. It is must, whether it is VIP or whether it is a normal patient attending the institution. Allow second opinion and referral to the colleagues. We should have very strong referral system, and there should be no inhibition in referring a particular patient. If a patient of fever comes, if fever is persisting, it is always advisable that the related consultant's uh, uh, opinion may be taken in the interest of the patient. Be conscious of cost of healthcare. Avoid publicity, self-promotion, and abuse of the position. And of course, there are regulatory frameworks, they addresses this issue. And be a partner in promoting global health. I always used to say that one primary center also is a part of global health care delivery. And almost every institution, every component of the health system, that is manpower, that is infrastructure, that is institution, every component helps finally into the global health. And in the last, I used to say that patient is the most important person in our hospital. He is not an interruption to our work. He is the purpose of it. He is not an outsider in our hospital. He is a part of it. We are not doing him a favor by serving him. He is doing us a favor by giving us an opportunity to do so. If you display this message in the hospital, definitely it will be an eye-opener message for the quality of healthcare delivery. Thank you very much.